Dear friends from IMA Nasik, first of all, let me congratulate the team IMA, President Hemanta Sonani, Secretary Dr. Kavita Kadekar, Treasurer Dr. Pawar, and of course today's chief guest, my friend, President Director of IMA Maharashtra State, Dr. Ravindra Bhondwe. I want to congratulate IMA Nasik on this topic because this is very exclusive and a very innovative topic which are chosen for this today's year. Basically, this sex is a tabooed word. Everybody talks about it, but everybody avoids talking about it in public. Now, this is the thing in doctors. So what about the common people? Especially for those who are rather growing children. So they are really, they do not know so many things, and rather we have to update them, we have to educate them, and it's our duty. So my today's topic is adolescent education, those who are in adolescent age, and what they need and what we can. Now, what is we? Who are we? We are all graduates and postgraduates of modern medicine, of course, all the members of IMA, and we have in-depth knowledge of human body, then physiology, and all other systems. And who are they? These are all the young people, those who need this thing. And it's our duty, it's our social responsibility in today's world to educate them, because this generation is exposed to social media in such a way that they have very wrong concepts, and we all know. And we are also observing the increase in the injustice, increase in the violence and other things, especially when the man and woman relations are concerned. To get the knowledge for these students are who? That is their parents, whom they cannot ask. And still in this 21st century, no parent gives proper advice to his wards, to his children. Teachers, of course, there are teachers who teach science, as you all know, for the 10th standard and 11th standard and 12th standard. They have one lecture on one topic on adolescent education in their science book. But I've been visiting so many schools that mostly these teachers are the science teachers, and they ask the students to go home and read on their own and come prepared. So actually, the real thing which is not taught to these students, and that's where our role comes. So this adolescent reproductive sexual health education program is a must, and every doctor should do it on his own. Every IMA branch should go ahead with it. Already many of the branches have been doing it, even at state level and at national level. So these age groups, we have to find out that early age groups, even the 10-year to 12-year students, which are in 5th and 7th standard, the mid group, 13 to 15 years, that is 8 to 10 standard, adolescent group 16 to 18 years from 11th and 12th standard, and of course youth above 19, collegians, they all need this education, this information. And what this information, we'll talk about it. And of course we have to educate their parents. That is very, very important thing, because parents themselves do not know many things and many misconceptions. The parents also have, even the teachers do have. So we have this group gender-wise, boys and girls, and of course, in some cases, we have to talk to them in a mixed group of boys and girls. The topics, we'll discuss about the topics which are very, very important and which we must understand. So basically, today's conference is a sexicon. So what is sex? we have to give the in-depth knowledge or some insight about the word sex, how this word comes into being, how this concept came into being. As we all know, we can definitely give the examples. I've been doing this for last around 20 years to many schools. I've done around 2,500 lectures to the adolescent boys, as well as I've got 3 books and a audio-visual CD on this. So I've been rather uh, telling them that you all know the amoeba was the first uh, living creature in this world. Hmm? So what was it? It was a unicellular organism. The multiplication or the reproduction of the amoeba was by cellular division, by the division process. It was asexual process. After that, in the chain of evolution, at some point, the nature introduced the bisexual things and the sexual reproduction came into being. So we have to tell them that this is a thing that because why this sex was introduced for the reproduction. You are the part of the uh, at the end part of this chain of evolution, and for that the nature has created 2 sexes, man and woman, or male and female, and the main aim is to reproduce, to continue the race. So that is very, very important. So the understanding of sex is the involvement of a man and a woman or male and female. These basic things, we must wash it. And how these things go on? We have to tell them about the development of the secondary sexual characters, not only the secondary sexual characters, how they are different in boys and girls, about how a person, how a boy understands that he is, how he gets the signal that his youth is arrived. And you can definitely give the example of bedwetting or night wedding. So all these things we have to tell them because many times we all get such type of students, such type of young boys that they get nightfall, they come to you, they are very, very rather depressed or shocked at what I have done because you know how that dream is. So these wet dreams, nightfalls, all these things we have to explain. That is the arrival of you, nothing to be ashamed of it. Secondly, about the girls, fortunately in India, many of the girls, rather the schools, they teach all these things to girls. So that is good thing, but they give only some, they show only some uh, audio-visual things, and that is all. Because one of the companies have prepared a video on it, and they go through it. But many a times I've seen that the girls also do not know what is the menses. So we have to let them know all these things. We have to tell them about the differences about the female and male reproductive system. They have to know it. We have to tell them about the anatomy and physiology. And of course, as the youth arrives, we have to tell them about the all those things, how the hormones are released, and how do you get all those behavioral changes, how you get all those physical changes, how do you feel that attraction to opposite sex. Let these boys know that getting attracted to opposite sex, as you all know, that a boy in 4th standard, 5th standard, if a girl passes next to him, he just ignores. But when he puts his foot in youth, that time he'll look after again and again. So that is attraction towards opposite sex. He starts feeling some so-called love about girls. Girls may get similar type of feeling. So all these are the endocrinological changes which the nature has rather intended to do in you, and because the nature wishes to make you a full-fledged man or a full-fledged girl for the continuation of the human race. So all these things we have to tell these people. And of course, the emotional changes like anger, frustration, which is a part of their adolescent period. Of course, the peer pressure, how to be rather careful about it, how to get all those things, about the stress management thing, about the self-image, what is a good thing, what is a good face. Many a times the girls have some notions about their body physique and they get quite rather they think so much about the fashions and other things. So we have to tell them what is the body image, what is the real body image, what is the self-image. Same about the bodies. Then approach to parents and teachers. How should they respond to their parents and teachers? And of course, about the maturity. What is maturity? What is the physical maturity? What is the sexual maturity? What is the emotional maturity? And of course, the intellectual maturity. All these things we have to tell them. About the menses and the hygiene of menses, all these schools they teach, but it's our duty of especially the lady doctors or gynecologists, or of course the men also. We have to tell them what is menses and the hygiene precautions about the menses. But at the same time, I'll definitely rather like to inform all the boys also about what is menses, how it drives. Because we have seen many a time, even the married men do not know many things, the many basic things about the menses and about the sexual reproduction. So all these things should be taught to them. Remember, this is the world of knowledge, world of information. But the proper information should be given from us, and that is our duty, our doctor's duty, duty of all our we practicing doctors. About the sexual reproduction, conception, many people do not know, and students should know it. And how this conception takes place and how it goes ahead, all these things should be explained. Of course, the development of baby in uterus. They know many things because of the social media, because of the YouTube, some videos, or maybe sometimes some uh, uh, there are some articles on the web. But remember, what I have found that these articles may not be purely scientific, and only reading cannot confirm it. So we have to tell all these things, the steps in the uh, development of a child or in uterus. Then about other things, which are what is the foreplay, what is its importance, what are the sexual choices? Because in this world nowadays, the sexual choice is a thing which is very very important, and so many people, especially the young people, have very different opinions about the sexual choice. Remember that it is not a abnormal sexual choice. We have to inform them what is sexual choice, how they are differentiated, and what is important, because they should know. They should know about the law and other things about the gay people, about lesbians, and all, even about the transgender. These things, all these upcoming, rather the growing children should know it, especially the college going students. Then there are some abnormal sexual behavior, which has definitely some legal part of it, definitely some moral part in it. So we have to explain what is a normal sexual behavior, what is an abnormal sexual behavior. Of course, the disadvantages of sexual behavior are very, very important, especially the childhood pregnancy, the unwed mothers, STD, and HIV. Many times I have talked to the students about the HIV and STD. They get frightened, but let them get frightened. They should know what is the outcome of sexual behavior and how they should protect, what is the safe sex. These things, doctors, we have to tell all the students. About the HIV and AIDS, all the important aspects about the HIV AIDS causes, how to prevent, what are the causes, what are the myths about HIV, what is the treatment, what is the prevention, and of course, though rare STDs should be told to all these students. About the safe sex, condoms, what are condoms? The students do know condoms, but how it prevents, how it should be used, has to be taught properly to the college going students, to the young students, and of course about the OC pills and its advantages and disadvantages to the girls. Because mind well, right now many girls are using it for the contraception purpose. Even if they know it, do not know now, they should be rather they should use it after the marriage. So this should be taught in the initial period before their marriage. And of course, the emergency contraception. There are many myths and misconceptions about the emergency contraception. So these things have to be taught. Then there are some special topics in adolescent education. There are really special topics. This is part of the sexual education about what is masturbation. It is right or wrong. What are its advantages? What are its disadvantages? Whether it is practiced throughout, whether only the men do it or women do it, everything should be told to those students or to the young people. And most important about the laws about sex. Sex and law, the laws, special laws for women, the behavior towards women, the morality part of the your behavior. We have to tell the legal aspects of these activities. The gender equality, we have to teach them because it is all known that as the sex, how these two sexes were created by nature, then how these two sexes are equal. So gender equality is really a thing which is needed. And I'm sure that our lady members will definitely like it because we have to tell them right from the school day. The physical abuse, many of these students do not know what is a good touch and bad touch. Fortunately, in many schools, especially girls' schools, it is told. But I'm sure and I've seen that the boys are never taught about this good touch and bad touch. And physical abuse of boys is seen quite rampantly throughout. And for that, we have to tell them all these things. The substance abuse, definitely a thing which is very important age-wise. Then watching the pornography. Pornography is the largest content which is used by the students. You'll be surprised that even I have visited few schools where they, where the teacher had complained that the students they make the series of the pornographic content and they even the pen drive and they circulate among them. They watch it. Even by the invent of the smartphones, it is very available, easily available on smartphones. So we have to tell them what is pornography, why you can observe, but why you should not get rather you should not see it regularly, and why you should avoid it because it is one of the main things which are the you can say the one of the habit forming thing. Pornography is always considered. So we have to tell all the students and counsel on that. Then sexuality. What is sexuality? What is the friendship and what is the love? Especially it is very important for the students about 16 years old because many of them they do feel whatever they feel, whatever the feelings are against are about opposite sex is love. We have to tell them what is a love, what is a friendship, what is just an attraction, and what is a soft love, and all these things we have to explain nicely. And they definitely remember it. What is the marriage? Why marriage? It is not marriage counseling, but the basic reason for the marriage is very important because they know that one day we have to marry. Even the girls know rather certainly, but many a times the concepts about the marriage, the reason about the marriage, the things, the responsibility about the marriage, they also come under all these things. Because the sex is not the only thing which is required in marriage, but you have to see all the other things that we have to consider. Then the life skills of girls not be same, maybe different sometimes, but in today's in this modern age, there are so many life skills that students should know. Where to get the proper knowledge, that also they should know. And about the abstinence. In Western countries, it is never, this abstinence is never practiced. But in our country, the abstinence is practiced and advised morally, ethically, and of course, sometimes scientifically. So, what is abstinence? Is it possible? We have to discuss, because it is not possible. I have seen the students of 10th standard who have rather regularly doing sex, and when they are told about the abstinence, they are really appalled with by the idea. So, how to control it? Why masturbation is important? Why this control of your sexual act is important? Not only sexually, not only ethically or morally, but also for your health and other things. Because all these things definitely contribute to your health, that we have to tell them. So this is all these things I've been doing for last few years, and definitely I've talked to the students who have seen, they're from the lower class, who have seen the sexual activities of their parents. There, when their question answer session, I was really so many times I was really appalled by the idea they have. They know about the uh, these gay people, what they do. They want to know what is the sex power. They want to know the congenital abnormalities. They want to know whether the length of the penis is important. The girls want to know about the size of the breast and other things are important. The girls want to know about the exact sexual act. All these things, even the 9th, 10th, 11th standard students, girls or boys, they do know, but they are not properly guided. That they are not taught by the parents. They are not taught. They do not give proper knowledge in the on the internet. That's why we come in that picture. So it is my sincere appeal to all of you. When you are practicing doctor, you may not take a lecture. You may not take you can say a workshop for the students, but it is whosoever the child comes to you, when you understand there is some problem, we definitely can give some time to him and or her, that girl, and definitely clear their problems. Many a times they have these problems. They usually, my experience, your experience may be different. A young girl of say 14-year-old, she comes with a chest pain. Ended up, we ask so many questions. She continues that she has got chest pain. The main reason is either she has fallen in love with a boy, or she has some problem, or she was abused. I've seen so many times that similar experiences by the girls. So we have to talk to them. We have to uh, teach them. We have to counsel them. Whatever we have learned as a doctor, whatever we have learned as a doctors of modern medicine, we should imbibe this knowledge into these people, and that is one of the social responsibility of us. So I once again thank you all, and you invited me for this auspicious lexicon. Thank you very much. I'm really grateful to the IMA Nasik and their hospitality. Thank you very much.
Thank you, sir. That was a truly an informative session. Now the session is open for questions.
Yes, sir.
Chat box में question है.
Yeah. I told you actually. See, we call it as a, in colloquial language, we call it as a teenage, from 13 to 19. But even this, because of this availability to social media and the internet, even the boys of 10-year-old, yes, the 5th standard student should get it. So we have divided. I have been doing this with Symbiosis University that we have got three different models. From 5th to 7th, it is different. From 8th, 9th, it is different. And 10, 11, 12 is different. So for everywhere, we have to talk to them, especially in the early age, the 5th standard, 6th standard, the development and secondary sexual characters, all this. We should not talk to them about the different types of sexual activities and all. But the basic knowledge should be important. What is sex and how you become young? What is the difference between a young person and rather than boy? All these issues. So this adolescent education is not only the sexual education, but of course the other aspects of our life.
So by the age when we start educating them about sexuality, let's say from 7th standard, but the common phenomena that students are done with the pornography right from the 5th standard and 6th standard.
Yeah, that's why we have to talk right from the 5th standard. Right from the 5th standard, we have different modules. For the 5th standard, we have to tell them about the few things. And in question answer, definitely some students are extra smart. They know all the things. Even because this is the first question they ask. Every time in the question answer session, I ask the teacher to go out of the room and they ask what is the masturbation, what is the gay people, how many women I can have sex with at a time. All these things they ask. And we have to answer them very sincerely. And advantages, disadvantages of all these things. And basic concept, what is sex and why sex? That is the main important thing. We have to tell the young.